At the end of each OSPE, students often express that it was difficult and that there wasn't enough time to complete. A few obvious reasons are to be named: writing of unnecessary words, unnecessary facts, and getting the question incorrect. While there may be one or two challenging stations, generally all stations are designed to be easily approached by an average student. It's worth considering whether there are small habits or practices of yours that may cause above difficulties.
Focus on saving time by reviewing the question and writing information that earns marks, rather than adding unnecessary words that don't contribute to your answer.
As per the first example, let's frame this question. When a student has been asked to describe the injury, now imagine if one has written like this. Now he has started like this. There is a specimen of the human skull. There is a cut injury on the right side parietal bone. There is a missing part of outer table due to the leverage action, and so on. Now, as you can understand, no marks will be allocated for the word there is. Right? And again, the term human skull also not that necessary. So as you can understand, there may be a lot of unnecessary words that you are going to write there. So obviously, you are going to run out of time. As per the second part, now you have been asked to write about possible overlying scalp injuries. Now this is how that you are going to write: scalp contusions present, scalp lacerations present. So, as we can understand, now the term present is not necessary. Scalp contusions and scalp lacerations are more than enough. So, you are going to consume time to write the word present and present. And the last part of the question is features of the possible weapon. Now, again, the student has written there, the weapon should be. These three words are not definitely necessary. So if a student is going to write it as heavy, long-bladed, non-pliable, and sharp weapon, this is more than enough. So now you can understand how we can save time. Moving on to the second example, please read the question first. In this question, you have been asked to reconstruct the possible event. So it is unnecessary to write or repeat again. We all know that tibia and fibula are lower limb bones. So as a result, there is an X-ray of the leg. No marks, useless. And there is a tibial fracture and a fibula fracture. Again, if you can write tibia and fibula fractures, so you can save time again. And as a result, primary impact to the leg from the front and so on. So now you are going to write unnecessary words. If one can approach answering like this, I feel it is a way of time saving. Example 3. Again, you can read the question. Here, you have been asked to write 3 medico-legally important findings that you can see here. If a student is going to write like this, there are plant materials entangled in the head. So now, if one can write plant materials entangled in the head or even plant materials, yes, more than enough. We are going to give marks. If you want something more, you can write as a trace material. Now, as the second sentence, there is a tattoo mark that may be important for the identification. Again, you can understand there are many unnecessary words where you will not be provided with any mark. So there is a, right? So now, not necessary to write tattoo marks, little hyphen for identification. And again, hypostasis is visible on the back. Now, everybody knows that it is the back of the body. So, if you can write hypostasis hyphen time since death, more than enough. Now, you can understand how you are going to waste your time. Moving on to the last example. In this station, imagine that you have been provided with a BHT note. So, in this situation, now the consultant wants to have a pathological postmortem, and consultant had ordered to house officer to make arrangements to get done a pathological postmortem. So, the student is tasked to spot 4 or 5 mistakes that HO had done over his attempt. Imagine these are the 2 answers that had been written by 2 students. Now, the first one, you can understand how many unnecessary words are there, right? So, now the first student, that means written in the first, cause of death is wrong, cardiorespiratory failure is not a valid cause of death, right? Whereas to that, the second student written as had mentioned like cause of death is incorrect. It's not necessary to write again that cardiorespiratory failure, etc., etc. And as the next mistake, HO has not mentioned if he took consent from the next of the kin for the pathological postmortem. As you can understand now how many unnecessary words are there. So, whereas to that, if one can write like this, no consent was taken from the relatives, full stop. You are going to save your time, and you are going to save your time to read the question again. So, likewise, you can compare the answers up the top and bottom. One special point I want to highlight as well. I have uploaded a mock OSPE in the same channel with answers. Here, I have deliberately included lengthy responses for your convenience, as you wanted to grasp theories before examinations. However, during the actual examination, it's crucial to be smart enough.
Keep your hands free during the OSPE. It's recommended for females to wear a frock or a skirt with a blouse that has pockets. You can use these pockets to store extra pens, your ID, and admission materials. We've noticed some students carrying these items by hand from one desk to another, so please avoid doing that. When you're given a gross specimen, take a moment to look the back and sides too where applicable. You can stand up to get a better view, but remember that time is limited, so use it wisely. It's best to avoid handling brittle specimens. Instead, you can stand up and observe them from different angles if it is necessary. Unless you're told not to touch the specimen, remember that when describing a skull cap, you should also examine the inside of the skull vault. This is important because you can earn marks for inspecting the inner aspect, and otherwise you are losing that amount definitely. It's true that you've been given a chair or stool, but it's your choice whether to use it. If you find it easier to write while standing and have a better view of the specimen, you can decide whether or not to use the chair. Always follow the arrows that show your direction of movement to prevent accidental falls and save time for yourself and the student next to you. Usually, it's a clockwise movement.